Hello, my name is Dr. Heidi Gullett, and I'm the Medical Director here at the Cuyahoga County Board of Health. Over the last few weeks, we have trained medical professionals and other health profession students to help us with our case identification and interviews, as well as contact tracing. We've received a lot of calls from people around the country asking how we got this going, and so this video is a training video to help those who are doing case interviews and contact tracing for us. This can be viewed by people who are going to continue to help us here at the Cuyahoga County Board of Health, but also those elsewhere who are interested in getting students and other health professionals into contact tracing and case interviews. I'm going to spend the next few minutes walking you through what we use as our case interview protocol. These are things that we've determined over the last few weeks are very helpful for understanding how COVID infection is affecting individuals as well as others in our community. Case interviews typically occur after we get notified that someone has a lab-confirmed case of COVID-19. We then call that person and walk through the interview I'm about to talk to you about. And then we gather information about contact tracing and who else we might need to contact who may be at risk for the infection. In a separate video, we'll talk about contact tracing and what the interview with that encounter looks like. So when we begin case interviews, we have a packet of information that usually has very limited information, usually someone's name, their lab result, and occasionally it may have some clinical notes if the person is in the hospital. All of that information is given to a case interviewer, and then they proceed to follow through a packet of information when they call the patient. I'm going to talk through some practical tips for getting information correctly and also help you understand some other things that are necessary when we do case interviewing for COVID-19 specifically. So the first part of this is that we have created our own packet that builds upon the Centers for Disease Control information as well as the Ohio Department of Health information. We added additional pieces to our packet that have helped us get more information that we feel is giving us better opportunity to actually track this infection in our local community. In your community, you may choose to use some additional information or add or change things to the packet. We've made all of the pieces of information and the documents available online so you can use them as they help you, but you can also edit them as you see fit for your local context. So the first part of calling someone is always building rapport. When I'm training our medical students here to do these interviews with us, I always talk about them using their best Tuesday morning skills. Tuesday morning is where we teach doctoring skills, where we teach about building rapport and building relationship. This is a lot different than a normal relationship that we build in the office with a patient because folks are on the phone and they're also sometimes not actually aware that they have a positive diagnosis. So many times when we're calling them from the health department, we may be the first person who's actually notifying them about their positive lab result. So we ask that you please call the person and use two identifiers, their name and typically their date of birth might be all that you have available. Once you've done that and you're sure you have the right person on the phone, it's important to try to build rapport as quickly as you can. It's also important to begin with an open-ended question like, we got notified that you had COVID-19 testing. Has anybody called you with your result? That allows you to get a sense for whether the person actually knows about the result or not. And if they don't, then it's an opportunity for you to continue to talk to them and actually break the news, which is really hard after the first few minutes of talking with someone. After that, once you've made the diagnosis or they are confirmed to have known about the diagnosis, we would like you to ask the next question before you go any further, which is, what is your preferred language of oral communication and your preferred language of written communication? We have our materials translated in many different languages, and we want to make sure that when we send written materials, people know exactly what they're reading. We also have an opportunity to use the language line, so if anybody needs to speak a different language, we will stop the interview at that time and transition to using the language line through an iPad. That's a very important part of us ensuring that we have equity, diversity, and inclusion included in all parts of these case interviews. Following that part, we're going to have you walk through the rest of the packet, and the packet is available for download online, so you can follow along as I'm explaining these different parts of the interview. We created our own internal tracking document because we have a lot of different letters going out to people. And sometimes someone may get one letter and then later develop symptoms and get a different letter. So we created this internally. You're welcome to use our form or create one of your own. But after the first few weeks, we realized we needed this to ensure some consistency and quality control internally. We also know now that we have a lot of different people who are contacting our cases. When we first started, we assigned a doctor or a medical student to each case, but we're now approximating 400 cases and it continues to grow. So at this point, we have a documentation section so we know every single person who has had an encounter with the particular patient or case so that we can track who's been talking to them. So we'd ask you to please put your information on those tracking sheets. We then would ask you to move on to what we call the PUI form, or Persons Under Investigation form. This is actually a federal document for the Centers for Disease Control and Prevention, and it gives us all the information that the CDC wants on every single person diagnosed with COVID-19. It's a bit of a technical document and the font is kind of small, but the best way to start actually filling out this form is to ask an open-ended question, something like, can you tell me a little bit about your infection? Or tell me about the last few weeks. In general, most people will then give you most of the information you need through a conversation, which then continues to build rapport and hopefully put them at ease during a very stressful time. Once that open-ended conversation has gone to completion, you may have to ask some very specific pointed questions that get you through all of the information on the front page of the PUI form. One of the most important things you need to clarify before you move on in the packet is the date of symptom onset, because that is the date that we use to determine when somebody that is a contact would need to be quarantined for 14 days from the symptom onset and their interaction with that person. So it's critically important that you document that. We would then have you move on to the second page of the PUI form. This particular page we've actually added some elements to because at CCBH we've discovered there are a lot of different symptoms associated with the COVID-19 infection that seem to occur a week or two before the fever, cough, and shortness of breath, which are the telltale signs of this infection. So we do what's called syndromic surveillance here, and we're learning more about this infection and how it unfolds for different people. So we're asking about a lot of different symptoms. The CDC form has specific symptoms listed. That would be typically what you would look at as a review of symptoms in a normal medical interview. And all of those things are here. During the open-ended part of the interview, they probably will answer a lot of the symptoms that they've had. But if they didn't touch on all of them, we would ask you to circle back and say, now there are a list of symptoms here I'm going to ask you about. Please identify if you experienced any of these. And then it's important on the side of the second page to please document the date that they experienced these symptoms, because that helps us understand the course of infection. You then move on to a past medical history, and it's really important that we understand people's comorbidities or the chronic diseases that might make them at risk for complications or even death from this infection more than somebody without these. So we want to understand their past medical history, and you can follow through on this form and see what we're most interested in knowing and what we have to report to the CDC. At the bottom, there's additional testing, things like influenza, RSV, other viruses. You may or may not know from that patient what they had done, but try to complete it as much as possible. It's important to remember that everything that you put on this PUI form must be entered into the Ohio Disease Reporting System that is ultimately then transmitted to the CDC. So completeness is of the utmost importance so that at a national and state level, we can understand how this has impacted our population. Next, we would ask you to move on to the next set of documents, which is from the Ohio Department of Health, and it's called a supplemental form. It is multiple pages long, and the center pages, you can familiarize yourself through a download on our website, includes information about travel, as well as visitation to healthcare facilities and other places where people may have become exposed to you if you were symptomatic. So we would ask you as the interviewer to please walk through each of these questions. Although traveling at this point has become a little less problematic because most people aren't traveling given all of the stay-at-home orders. We have, however, even in recent days, identified new flight manifests where people who have now tested positive were symptomatic on flights. So it's still important to ask that because we do have to report that information back to the Ohio Department of Health as well as then on to the CDC. The final page of the supplemental form is critically important. All pages are really important, but we want to highlight things that I really want you to focus on. This last page is where we begin to identify the contacts that a lab-confirmed case may have experienced. This page is a list of all of the contacts that someone has had within 6 feet for a reasonable period of time since they became symptomatic. That tells us anyone who's at risk for transmission for this infection, and those contacts then need to be quarantined. And in a separate video, we'll talk about the contact interview. Important on here is that the top of this sheet must be filled out. The top of the sheet has the case information, so the person's name and identifiers, But it also has the date of symptom onset, which is really important because if somebody had been symptomatic, had contacted someone 3 weeks before they were symptomatic, that's not a contact, and we don't want to be contacting that person. So we want to be very precise about the times when people became symptomatic. And on the far column, we also want you to ask that person, the case who's giving you these names, we want to know exactly when they interacted with that person to the best that they can remember, because we want to know when they were symptomatic and had the interaction with that person. That's the date at which we would set their quarantine, and I'll explain that in a separate video. We also need to know how to contact this person, so phone numbers are really important. Some people are reluctant to give their contacts information, but that goes back to why it's so important to build trust and rapport earlier in the interview. And sometimes people also want to verify the identity of the interviewer, so we're always about making sure people are comfortable with the person who's taking this information. And we always try to protect privacy whenever possible and not give any protected health information, so you can reassure the people you're interviewing that we protect their privacy in all ways possible. Following this particular part of the interview, you may have some other questions for people, and we've provided you with some additional pages as needed. The last piece I want to talk about is sometimes when people are on a case interview, they will say, you know, my household contacts are right here, you can talk to them. But we don't want that to happen. If you have someone who has a lab-confirmed case and they're on a phone, they should be isolated in their home. And so they should not be talking to their household contacts in close contact, and they should not be handing over a phone that has any sort of secretions on it, because that would increase the risk that they would transmit the virus to their household contacts. So it's important to let them know that we will separately contact their household contacts, ideally on a different phone, but if that's the only phone for the household, it would need to be wiped down with gloves, and then we could contact that person a little bit later. There are several other elements to the case interview that I would like you also to focus on prior to concluding the interview. One of them is around isolation. So part of this call is to get information, to identify contacts, and also to begin to piece together any potential clusters in the community, other cases that may have had positive infections as well. But part of this is also about educating people about isolation. It's really important that anyone with this infection understands what isolation means. So we carefully walk through what that means. And we have other resources available at the CDC and ODH and our own website about what isolation means. So you should familiarize yourself with that before you begin a case interview. It is, however, important to do a really good social history on the phone so you understand who is living in the home, how many people, what the floor plan looks like, and is it truly feasible for someone to isolate away from their household contacts? Is it possible to be alone in one room with the door closed? Is it possible to only use one bathroom? And if it's not, it's important for you as the interviewer to begin to problem solve with the person on the phone, to think about how you can minimize transmission in the home. The second piece of that then becomes about resources. If someone cannot safely isolate in the home, we need to begin to collect an understanding of what resources we as a community need to provide to this person. It is our both legal and ethical duty to ensure that someone can safely isolate when they have an infection like this. And so that might mean that we consider providing them with cleaning resources if there's only one bathroom, or providing them with limited PPE if they're the caregiver for a disabled family member and there's no one else to care for them. Or it might mean that we provide food for a certain period of time if that's the only person who can prepare food for the home. We try to be as creative as we can, and we work with our resource unit leader to identify those needs and have them met as quickly as possible. The funds are not unlimited and we have limited resources, but we will do our very best to ensure safe isolation. So that's a very important part of what you're doing in this case interview. Next piece is that sometimes you will also identify that a household contact is actually sick themselves already. Those people are unlikely to get testing because we have limited testing availability right now. So it's important to tell the person that you're talking with, get the information for that household contact as if they were asymptomatic, like we talked about earlier, and that we'll call them again later. In the contact interview, I'll talk about the difference between a contact who is symptomatic versus a contact who's asymptomatic. But the bottom line is that if you end up calling a contact and they're actually having symptoms, they now become what we call here a presumptive case, meaning that they are somebody who is symptomatic, who has an epidemiologic link to a lab-confirmed case. And that means that we presume that this is a COVID-19 infection in the absence of testing, and we treat them as such and move on with a full case interview like I just described. Finally, I'd like to review the contents of our isolation packet. Every time we do a case interview, we get an isolation packet and we send that to somebody who's had the case interview. The packet is available on our website for download and you can look at it. We've continued to use our process improvement to update the packet over the last few weeks, and we will continue to do that and repeatedly post our updated packet. But just so you know, it includes an order of isolation, which is actually very detailed and explains exactly how somebody can be cleared from the infection once they're over and be able to discontinue isolation and return back home. It also includes a physician line 24/7 that anybody that's a case or a contact can call at any time to talk about their symptoms, if they're getting sicker at home, or with any questions. It also includes a checklist that comes from the Ohio Department of Health that gives people guidance on what isolation means at home, because this is a lot of information to give someone, especially after they've just gotten a very serious diagnosis. We also include a mental health, anxiety, and stress management packet. We like to make sure that people know how they can reach out with regard to behavioral health services. This is a very stressful time, and we want to highlight this isn't just about physical health, but it's also about mental and behavioral health as well. And finally, we give them a green sheet here. This green sheet was created in conjunction with all of the emergency medical services across the county, and and they have approved this. And what happens is this isolation packet, if someone becomes sick at home and needs transport via EMS to the hospital because they're getting sicker, they show this green sheet, and our EMS workers know that this is someone who's been diagnosed with COVID-19 or somebody who we presume to have COVID-19 if they weren't able to get testing but they were a household or close contact that's now symptomatic. So it's important for us to try to protect our frontline healthcare workers, and so this is what this is all about. Most of our EMS are using universal precautions at this point too, but we include that just as another element of communication, and then also stays with the patient until they get to the emergency department. We typically call ahead as well to the emergency department if the patient notifies us they need to go in, but this green sheet that goes with the isolation packet gives everybody a chance to be aware that this is somebody that needs precautions for COVID-19. This concludes the part of the training video for the case interview, and we'll separately do the contact interview at a different time.